Hello, I'm Dr. Phil Memoli. We're here to talk about biofilms, systemic disease, and periodontal disease. What exactly is periodontal disease? Periodontal disease, basically, if you can picture a tooth, around the tooth there's bone that holds the tooth in, and then on top of it is a thin layer of gum. That thin layer of gum basically is the thickness of 3 millimeters, which is our magic number in dentistry. At 3 millimeters, we can maintain a normal flora. Okay, that's the key to this 3 millimeters. In terms of getting periodontal disease, when the overlaying gum becomes infected or inflamed, that's what we call gingivitis. And we find maybe 90% of the population has gingivitis, which appears in their teens. Once that gets infected or inflamed, it may or may not be associated with bone loss, which occurs under the gums. This is why it's insidious, because you can't see this happening. Bone infection or bone inflammation leading to bone loss. And we classify bone loss as early, moderate, or severe. The key here is as the bone loss gets deeper, we're creating a deeper pocket. So that 3 millimeter can turn into 4, 5, 6, 7, 8. The importance of the depth is that there is less oxygen and we get more of what we might term bad bacteria living down there. And that's the importance of that. The body may assist with this. That's if the gum doesn't recede. If you're clenching your teeth or brushing too hard, the gum might recede, and that could be the body's way of trying to maintain that 3 millimeters. Once that periodontal disease is established, how does it affect the body? And this is what we call systemic interactions. Whenever a local issue affects the body, we call that a systemic infection. Right now, there isn't much agreement over what causes periodontal disease. But what we can say is there is an issue going on with the bone. We're actually getting bone resorption, meaning the bone's dissolving. Periodontal disease could be considered a systemic infection based on bacteria from the gums getting into the body and attacking the organs. The two main issues we have to concern ourselves with is the actual bone loss. The second issue being the biofilm. And biofilm is a combination of bacteria, viruses, yeast, fungi, parasites, and how these interact, how these get out of the local environment here and get into the body. Once they get into the body, some of these systemic interactions, some of the organs that might be affected are what we call primary organs. Primary organs are primarily responsible for keeping you alive, your health. The heart, the brain, the lungs, kidneys, liver. These are considered primary organs. A lot of research is being focused on all these organs. There's recent research on Alzheimer's disease and how that may be propagated also by periodontal disease. Regarding periodontal disease, one issue for our consideration is what is the cause? A lot of people consider getting to the cause as being academic because they're going to treat it irrespective. In a biological practice, the focus will primarily be on treating the cause and also secondarily treating the symptoms. We're dealing with bone loss. So is the bone loss a systemic issue, meaning is it caused by a nutritional deficiency that affects the body and then makes us more susceptible to lose bone in the jaw? Or is it just a local phenomenon where the bacteria shift to a dysbiotic or unhealthy type of bacteria and get the whole thing started? Or could it be a combination of both? So in terms of periodontal disease, let's consider for a moment the systemic issue, possibly a generalized nutritional deficiency. So when we think nutritional deficiency, we have to think of at least 3 or 4 different factors. We have to think about adequate dietary intake. We have to also consider maldigestion, and we have to also consider malabsorption. The result of one or all 3 of these being an issue can result in an issue called prioritization, where the body sequesters nutrients and sends it to the primary organs. And hence, organs like the mouth, hair, skin don't get the proper nutrients that they need. So let's consider first the dietary intake. In terms of dietary intake, one of the key factors would be, if we're thinking gum disease, is vitamin C. As you know, scurvy, which was an issue for sailors on long trips, and whereas they would get gum disease, that's how we first became aware of gum disease. I need to stress here, vitamin C is sodium ascorbate. It's not ascorbic acid. Ascorbic acid is an acid, okay, whereas sodium ascorbate is a mineral, has a mineral in it, and it's going to be more alkaline. There could be a problem with people taking high doses of vitamin C, causing an imbalance in their acid alkaline. Another consideration is minerals. So we have calcium and magnesium. A lot of times these are complexed in vegetables or in grains. They're complex with phytic acids, which prevent us from absorbing the minerals. So there are ways of soaking it and fermenting the grains so that we get better absorption. Unfortunately, in the gut, there is some competition between magnesium and calcium. Another consideration is the fat-soluble vitamins, A, D, E, and K, which are essential for tooth growth, tooth maintenance, and bone growth and maintenance. One of the issues with fat-soluble vitamins is they're highly susceptible to breakdown from heat and processing. So it's very difficult to get these vitamins from any food that's cooked and from any supplement, because once they're processed, they're destroyed. The next consideration would be assuming that we're getting the proper nutrients and we're putting them into our body. Now there's the digestion factor. With the digestion factor, the primary factor for digesting protein is hydrochloric acid. So if hydrochloric acid isn't at proper levels, or if it gets extinguished by drinking water, if you eat a lot of cooked food, the food is dry. The body sends the signal to drink. You have to hydrate that food in order to digest it. So when you drink water while you're eating, you're depleting your hydrochloric acid. That means that proteins aren't going to be broken down into the proper amino acids. That's also going to be a major factor with bone growth and bone maintenance. Another issue is that you're also going to create an acid-alkaline imbalance. When food isn't properly broken down by hydrochloric acid, your body will tend to become more acidic, and that's going to favor bone loss and teeth demineralization. And all of these factors considered and taken together basically results in a phenomenon called prioritization. And prioritization is just that. The body has a nutritional deficiency, and so it has to decide to send the available nutrients. So it's going to send them to the primary organs first. Your heart has to work, your brain has to work, your lungs have to work, pancreas has to work. Secondary organs become hair, teeth, gums, those sort of things that we can lose but still survive. So problems in that field generally tend to, if you connect the dots, it comes back to nutritional deficiency. And calcium in particular seems to be a big problem. Calcium, when the body is overtaxed by toxins, the body could switch to calcium metabolism. Calcium regulates 300 to 500 different systems in our body, so calcium is in high demand. And when the vital organs need calcium, it's either going to take the calcium from the food and prioritize it and send it to those organs and not to other organs like the mouth. Even if you're getting essential nutrients, there's a conditional demand, which means an increased demand. And then at that point, you could break down calcium in your jawbone or your other bones, and that free calcium would be sent to the heart to maintain it in normal function. Now that we've considered nutritional or systemic considerations, let's look at the local phenomenon, at the biofilm. And again, what is biofilm? In the past, we used to think of bacteria as being a little bacteria sitting there, and then our our antibiotic or our antimicrobial would hit it and destroy it. But we discovered most bacteria actually live in biofilm complexes. They don't live out on their own per se. So a biofilm is almost like a protective fortress. It's a little city, it's maybe a little proto-organism of a group of different type of microorganisms like bacteria, viruses, funguses, all living together for mutual purposes. Okay, being mostly for protection, because think these biofilms are in a hostile environment, our body. So they want to survive. We have coexisted with them, so technically if we destroy the biofilm, we may be destroying ourselves. There are more bacteria in our body than we have cells. So we have co-evolved with bacteria, and they're essential to our survival. Our survival is essential to them. And there are studies showing that these biofilms may be aware of the conditions going on through our body through primitive communication. So they are monitoring us at the same rate we are monitoring them. So they're typically an organism living inside of us. The biofilm is as healthy as we are. When we start eating foods that may not be healthy for us, they're also going to be unhealthy for the biofilms. Look at it this way. If we're eating garbage, the biofilm has to mutate to be able to eat that garbage and digest it for us and live off of it. So the more garbage we eat, the more dysbiotic or the more amount of bad bacteria that we're going to have. And what's the problem with bad bacteria? When we start with a normal, and I should say normal is questionable, but if we start with our initial biofilm, there are what we would call a predominance of good bacteria, and they would say there's some bad bacteria living there. But in essence, they're all really good. The quote-unquote bad bacteria are essential for the good bacteria to function. The bad bacteria only become bad when we get out of balance. So now these bad bacteria, the biofilms bring them forward and say, we have a crisis here. We're not getting good food. We're not getting an adequate amount of food. So you're going to have to digest, or you're going to have to deal with what is coming in. Now, those bacteria start proliferating because we've ingested materials that we can't digest or materials that are devoid of nutrients. So you're going to start to create a bad biofilm, if you will. And that bad biofilm isn't bad in of itself, it's just that it's trying to survive and help us survive, which is why we can tolerate eating all this garbage, because these biofilms are helping us out. Biofilms start having a negative impact themselves on the body. And what kind of impact could it have? Something called complex formations. The individual biofilms now start to cooperate with each other and conglomerate into bigger complexes. Form armies, if you will, as one of my colleagues put it. And there's different names for these. There's the red complex, the green complex, the yellow complex, and these colors designate what the stains that predominantly attach to this. So we're seeing different colonies. We're trying to stain them to identify the bacteria, and we see different bacteria are predominating. Different bad bacteria are predominating in these different colonies. Once we have complex formation, that's technically considered an infection. So how does the body deal with that? It has to activate the immune system. How does the immune system interact with the complexes? Inflammation. The problem with the inflammation is the inflammation. It's not the actual bacteria, but it's the inflammation being produced by our immune system, which is trying to keep these biofilm complexes in harmony with our body, that now starts the process of bone loss. The first stage of this is the loss of the bone matrix, the framework of the bone, the organic components, the proteins, okay, which we mentioned as being essential. So in the first stage, we lose the proteins. Okay, that's also exacerbated by an acidic situation. getting back to maldigestion. If that continues, the next step is actually the loss of the mineral portion of the bone. In the next step of bone resorption, we lose the calcium component in the form of calcium sulfate. So this raises the question as to the body's involvement here. So is it an accident that we are losing bone, or is it intentional in that this is one way the body can liberate calcium that's stored in the jaw and send it to the primary organs? Now that we've discussed the different possible causes of gum disease, one the nutritional component and the other being the microbiological biofilm component, now we have to consider how these two things together are causing systemic diseases or aggravating existing systemic diseases. And again, there's been a lot of work done on this. There's showing infections going to the heart, to the lung, to the pancreas, to the uterus, and other organs. Okay, I've actually written an article that's been published in the Integrative Gastroenterology book. But I think if we focus on the latest research that's been done on Alzheimer's disease and cognitive decline, this kind of helps to illuminate some of the concepts that we've been talking about more clearly. What it tends to show is with Alzheimer's disease, the issue is these plaques forming in the brains around the neurons. And initially this was believed to be the mechanism of the disease. But now researchers have found that this is actually a protective mechanism that the body uses to protect the brain. From what? From bacteria that are attacking. So how are the bacteria getting into the brain? We know from periodontal disease, we talked about the bone loss and then the quote-unquote bad bacteria getting into the bloodstream. Well, those bad bacteria can't get through the blood-brain barrier unless something else happens, and that is leaky gut. So when we have problems with the food that we're eating, when we have problems with digestion, we have problems with absorption, okay, so-called leaky gut now causes a particular problem. Leaky gut now contributes to leaky brain, which is a breakdown of the blood-brain barrier. Now the mechanism here looks pretty clear, and there's research by Kamer and research in Germany. In 2016, there were 3 more studies that correlated these things. It seems that these plaques that are in the brain come from constant attack by microorganisms. Not occasional, but constant 24/7. So the issue becomes, where are these microorganisms coming from and what organisms are they in particular? Well, as I mentioned, the mechanism is first the gut has to go down. First you need leaky gut. As I mentioned, there's 2 separate mechanisms going on here. One is leaky gut and one is periodontal disease. And both of these are going to contribute a constant amount of bacteria that are entering the bloodstream and possibly entering the brain. Now, in order to enter the brain, we need leaky gut first. So that raised the question, is leaky gut the bigger issue, or is periodontal disease the bigger issue, or are they working together? Well, they looked at the microorganisms that were actually causing most of the damage and causing the brain to produce these plaques, which are causing the Alzheimer and causing the cognitive decline. And they found out that the 3 most predominant organisms were spirochetes, which live in the gums, and of which Lyme and some of the co-infections are related to. The second one was herpes simplex 1, which also coincidentally lives in the mouth. The third was chlamydia pneumoniae, okay, which is another organism which coincidentally lives in the mouth. So what we're really looking at here is a combination of events. We're looking at problems with diet, which is contributing to leaky gut and which may be shifting the body's metabolism to bone breakdown. Okay, hence we're seeing increased osteoporosis in society, so that calcium is available for the primary organs. The other thing we're seeing is once that intestinal barrier breaks down, then we see the blood-brain barrier breaking down. And now if the person coincidentally has periodontal disease, that those particular organisms that the brain is most susceptible to are getting into the bloodstream, they're getting into the brain, and they're causing the damage. So it looks like it's initiated by diet and it's propagated by periodontal disease. Further studies have been done to try to deny or confirm this, and what it was discovered is that factors such as you brushing and flossing your teeth and you getting regular cleanings have a major impact. These are issues, and these are confirmatory in that recent hypothesis. What natural things help prevent this? Well, what we found is when you give people curcumin tends to reduce inflammation. So curcumin tends to help the periodontal and also the cognitive decline. We see this with green tea. Green tea seems to stimulate more salivary flow. We see this with melatonin levels. People with high melatonin levels, meaning people who are sleeping and have natural normal sleep cycles, tend to have less periodontal disease for some reason and less cognitive decline. We also see it in berberine, and manuka honey seems to interrupt the development of new biofilms. Adding these natural remedies is not addressing the causes. It's putting a Band-Aid on some of the effects. So I tell people these are good things to do, but it's got to be part of a bigger picture. Now that we've considered periodontal disease from a local and a systemic nutritional-based perspective, now we need to consider, well, how do I treat my periodontal disease? I go to my dentist and he says everything's fine on a year-to-year basis, it's not getting worse. But is it slowly ebbing away at my vital organs, my cognitive function? Is this part of this paradigm, this concept? And what we really have to do is a comprehensive local systemic nutritional type of periodontal program has to take into consideration, yes, we have to do the basics. We have to do the periodontal charting. We have to see where our gum levels are, where our bone levels are. That's our baseline. Certain things that make our bone loss go into the advanced stage. Some of this is related to smoking. Some of this is also related to functional issues in the mouth, which are related to clenching or grinding or bruxism, TMJ, and the like. There's another phenomenon in the functional area of myofascial, things going on in the shoulders, back, neck that are causing increased clenching and grinding of the teeth, which is exacerbating the bone loss. These considerations also need to be considered in order to stop that advancing of the bone loss as far as from a local perspective. Once we have that local perspective under control, now we can start considering the nutritional aspects. The next thing we talked about is proper digestion of these. There's problems inherent in GERD. Okay, we know that digestion is compromised. The other thing is absorption, being the third step, which is compromised in a large portion of the population. Pesticides, for example, can cause leaky gut. And there's a lot of other things that cause leaky gut. These are all things that have to be considered, assessed, and handled, okay, managed. The other thing is a systemic assessment. The idea is what systems out there are preventing damage to the primary vital organs. These two systems are primarily the immune system and the detox system. Saying the triad here, which is the local prevailing conditions in the mouth, okay, which includes the periodontal status and the status of clenching and grinding, the functional aspects of that, and particularly habits that could cause bone loss, such as smoking and other things. The next consideration would be the nutritional component, which is possibly causing the depletion of the calcium and promoting the inflammation. The next system we have to consider is the systemic components, which are protecting the primary organs. Those primary organs being heart, brain, lungs, pancreas. Part of these considerations are the detox system and immune system in particular. What we have to remember, what is leaking out of the bone and going into the bloodstream, okay, besides calcium? The first thing are the microorganisms. That's going to be addressed by the immune system. The second component is going to be the toxins from the microorganisms. That has to be addressed by the detox system. Okay, so that's a component here that is ignored to a large part. Why do we have to deal with the detox system? The detox system is the primary defense system. Once the detox system goes down, now the immune system has to work 10 times harder. So it behooves us to make sure this detox system is functioning properly. People with these type of problems going on, some toxicological studies point to the fact that when people hit their 50s and 60s, the detox system may only be able to respond at maybe 50%, 50 to 60% at the most. I'm seeing people who are responding in the 5 to 10% range, who have advanced gum disease and have other diseases. So there may be a clear correlation there. More studies obviously need to be done. The second part is the immune system, okay? So once that detox system goes down, and if you're functioning at 5 or 10%, the body now has to rely on the immune system. So what is the immune system dealing with? The immune system is dealing with the microorganisms that are escaping. It's dealing with the immune complexes. It's responding by creating inflammation. And then that inflammation that's localized to the mouth can now escape into the bloodstream and create a phenomenon of systemic inflammation. So now the whole body becomes inflamed as a result of having gum disease. These are the considerations in a comprehensive periodontal assessment. Is periodontal disease a local disease, which just primarily involves flossing, brushing, going to your dentist? Or are you now of the opinion, which is what the research is starting to point to, that periodontal disease is this greater aspect of a bigger picture, and which is actually exacerbating that big picture? That big picture including the local phenomenon, including the systemic reaction to that, and including the nutritional predisposition to it. And it brings us back to our first question. What is periodontal disease? Is it only a localized phenomenon that requires you to go to the dentist and brush or floss? Or is it this more bigger biological, systemic nutritional issue, which involves a much more comprehensive and team-oriented approach? So we thank you for listening to our ideas on periodontal disease. We wish you the best in health. Thank you, Dr. Phil Memoli.